everyone, welcome back to my channel. If you are a returning subscriber, thank you, and if this is your first time tuning into this channel, you are welcome. Please do not forget to like and subscribe to this channel and turn on your notification bell so that whenever I post a new video, you'll be notified. So today we'll be discussing about autism spectrum disorder. Why I wanted to contribute or create more awareness to this particular topic is because I had a flashback based on when I was a little child, and I realized that a lot of our parents back then were ignorant of situations. Whenever they see a child that is abnormal, they tend to term them as imbeciles. The society, the environment, everyone would term them as an imbecile, and which I just want to also partake in creating more awareness that it's not every child that you see that you term him as an imbecile. They have different types of disorders. I had an encounter with a woman who had a child that is autistic, and the woman keeps doing transfer of aggression to people, like everyone is the cause of why her child is autistic. Autism spectrum disorder is a condition that affects the development of the brain, that impacts on how someone or a child perceive or socialize with people around him. You will realize that a child that sees his friends or his peer groups playing, and then you realize that this particular child is so reserved, he keeps to himself, that he can't relate with his peer groups. If there is anything enticing that makes children feel enticed, you realize that this particular child is not moved by those things. And for example, if children sees aeroplane on the sky, you notice how happy they are, how excited they are. They start screaming aeroplane, and then you realize this particular child he's lost. He doesn't know what is going on. He doesn't know what is exciting those people. He's not even in touch with what is exciting them. He has no idea because of the condition, the disorder in the brain. And you realize that a child that has autism cannot answer his own name. Whenever you call him, you keep calling him, you realize that they are there but they are absent. So that's when you begin to know that, okay, this child has autism. And autism, you can't just give birth to a child and you just feel like, okay, this child is having autism. Autism is normally diagnosed from the age of 18 months to 24 months. That's when you know, okay, this child is more than a year. Why is he not acting like his peers? Why are things not exciting him? Why can't he interact with me? Why is it that whenever I ask him, he finds it difficult to communicate with me? Why is it that whenever I talk to him, whenever I give him something, it doesn't entice him, it doesn't make him happy? The child is always to himself. The child is supposed to start saying one, and then he's supposed to start saying mom, but you realize that instead of talking the normal way, the child begins to use some tones that you don't know where he got them from, to start talking, to start making noise and all that. That's when a specialist will know that, okay, this child is autistic. And autism can be managed when dictated early. So if a child is from the age of, let's say, from 14 to 24 months, it can be managed, yes. And then the spectrum will not be wide. It will not be wide as that of the one that is being delayed to dictate. You realize that an autistic child has this repeated pattern of behavior, like they keep repeating things that they do around the environment. You realize that they don't indulge in communication. They don't, when you send them on an errand, you have to keep emphasizing, when you ask a child to, can you please get me that slippers over there, you realize that it's not responding. You have to calm down and you explain what you actually want them to get for you over and over and over before they will pick it up, and then they can hand it over to you. But you can't just tell an autistic child to pass me that slippers over there and then he just go there and pass it over to him, because there's a disorder in the brain that doesn't process this information to them. So you have to keep gradually repeating yourself and explaining yourself to these particular children before they tend to understand what you're saying. And yes, before autism gets intensive, it can be treated. It can be treated, but autism doesn't have a cure, but it can be managed. And while it's being dictated early, it will be managed very well, and that child will have a difference compared to those children that were not dictated early. What are the causes of autism? Number one, having a family member or immediate family member who is autistic. It can also prompt that, okay, because it's an immediate member of the family that is autistic, that means you know where the problem is coming from. Or having older parents, when at some cases though, when both parents are very old before conceiving, it affects the development of the child, and mostly it's on the brain. So most older people that are even wishing to give birth tends to have an autistic child. Then the third one, we have certain genetic mutation, and the fourth one, we have Fragile X syndrome genetic disorder. We have metabolic imbalances. And the last one is when you exposed to heavy metals and environment toxin. It also affects the development of the child in which you carry, and it will tend to produce an autistic child for you. And what are the ways, or what are the symptoms of an autistic child? Number one, you realize that they always tend to avoid eye contact with everyone around them, and then they lack to respond to their names. Yes, when you call a child, Desmond, can you please come? Desmond, come and hug me. Desmond, they not respond to their names. Is loss of skills. You realize that, okay, my child, when he was 1 year old, he knows how to call mommy, and then all of a sudden he doesn't know how to call mommy, he doesn't know how to say one, he doesn't know how to say two again. And that's when you realize that they have loss of skills, already learned skills. 0 to 14 months, it's very hard for you to dictate a child that is autistic from those age range. Also, they also speak with abnormal tone or readings, like they sound like robots or make a sound like robot. That's when you realize that, why is this child acting abnormal? That's when you know that, okay, these are the symptoms of an autistic child. You realize that even when you get a doll for your child, before you realize that this child is acting abnormal, you realize that this doll that I got, or this toy that I got for you, is supposed to make this child excited, but realize that the child will keep looking at the toy like they don't really send it for them. You feel like, is it that this child doesn't want what I got for him, or is something else wrong with him? Yeah, actually something is wrong with him, because they will not respond to the excitement that you desire from a child that just got a new toy. They will not give you that excitement that you need, and that's when you need to take your child to a specialist so that they will examine him and diagnose him, so that they will tell you how to manage, and they will start the proper treatment on how to manage your child autism spectrum disorder. I just hope that this video will be helpful to many other people that are yet to know about autism spectrum disorder and do not really think it's a big deal. It can be managed when it's being dictated on time. Please, let's do not forget that we all need love, both inside and outside. Let's keep sharing love. Let's love our neighbors as ourselves. Thank you for tuning up to this time. Please don't forget to help in growing this channel. I'll see you in my next video. Thank you. Bye.